So you heard from your neighbor's barber's cousin's gardener that if you go and get your neck adjusted at a chiropractor's office, it may result in a stroke. Well, I'm here to dispel a lot of the myths about that statement. We're gonna go over the science, we're gonna go over the facts, we're gonna spell it all out for you. You'll have a good understanding when I'm done. I'm Dr. Paul Koch, and welcome to Uncommon Knowledge. Hi, I'm Dr. Paul Koch, and welcome to another episode of Uncommon Knowledge. In our office and on our website, AskDrKoch.com, I answer a lot of the same questions, and a common question my patients have is about the safety of their getting their neck adjusted and the potential risk of stroke. It's a common question. Today we're going to go over the stats and facts that go along with the safety record that chiropractic has had when it comes to adjusting people's cervical spines. So what happens? Stroke is a very common occurrence. And what kills Americans, stroke is number 6 on the list. And nearly 800,000 people every single year have a stroke. It's something that in a population of maybe 300 million plus people, we have 800,000 actually having a stroke. So it's a common occurrence. People will have a stroke every 40 seconds. And every 4 minutes somebody dies of stroke. 130,000 people every single year die of stroke. So my point is with this, it's a common thing. It's going to happen a lot, whether it happens in the Wawa, in your bathroom, playing sports. It's just something that sometimes just happens. So when we look at what causes people to die, I said stroke is number 6. And the number 1 thing on the list is heart disease. This is a slide from the CDC, mostly from the CDC. And heart disease is the number 1 killer of Americans. It kills 614,000 people every single year. The second thing that causes people to die is cancer. Cancer kills almost 600,000 people too. And if you notice, this is filled in red. That says medical mistakes. And that is a stat that's not kept by the CDC. The CDC does not pay attention to those numbers. But the British Medical Journal did a study and looked at what kills Americans. And number 3 on the list, with nearly 230,000 people every single year dying, or no, 250,000 people every year, die from medical error. So medical error is very common. 250,000, 130,000 people have strokes. So when you're concerning yourself with what are the real risks to your health, please understand that just error alone in a medical setting can be very, very dangerous too. So that paper from the BMJ is right here, and I'll put a link to this in the comment section of our video, so you can read that if you like science. I'm going to put a link to all of the scientific studies that I'm listing in the link to this video, so you have a good understanding, and you can read them for yourself if you want to do that. So putting your relative risk of having an injury with chiropractic, we have to put it in reference to a lot of other things that we do. So when you look at this slide, we've got the overall risk of death from spine surgery. So as chiropractors, we're always hoping to fix problems so that patients don't need to eventually have spine surgery, and we do a great job of it. But if you do have spine surgery, you have a 1,800 per million risk of dying from having spine surgery. From having cervical spine surgery, your risk is 500 per million cervical spine surgeries. And that's what we're working on with the neck when people are concerned with stroke. When we come down, and this next stat is something that is, I think, the most terrifying, because it is the combined risk of NSAIDs and aspirin. So whether you take one or the other or both, what's the risk of dying from just taking over-the-counter medications, which most people take? That's something that no one really comes in here first. Most people have taken these medications hoping to get well, and when they don't, they finally break down and come to the chiropractor or go to their primary and get more of these NSAIDs. But your risk is 153 in a million people. So these numbers are pretty substantial. The number of people from opioids dying is 53.6, and this number isn't opiate overdoses. We are in the middle of an opiate epidemic. We all know someone who's been affected by it, and people who abuse opiates are dying left and right. This number is just properly prescribed, properly taken, people who die from just taking these opiates. Chiropractic has had a great success in helping people avoid opiate prescriptions, and there's a study done not recently that showed how successful chiropractic was at reducing the number of opiate prescriptions that people need to take. So the last stat is the association of neck manipulation, or adjusting we like to call it, and having a stroke. and not dying of stroke, but just having a stroke. And the number is less than 1 in a million. And we're going to go over the real numbers in just a second. So when we look at what those numbers are, there's a couple key studies that we look at. And the biggest study done so far to date is called the Cassidy Study. And what the Cassidy Study looked at was, what is the risk of someone having a stroke, whether they go to their primary care office or they go to the chiropractic office. And what they found was that the rate of stroke was the same whether they went to their primary or to the chiropractor, even though the primary is not manipulating their neck. The bottom line is, the symptoms that cause people to go to the chiropractor or go to their primary are the same symptoms as you have when sometimes you're having a stroke. So people often go to the doctor in the throes of the stroke. The medical doctor or the chiropractor didn't cause the stroke. The people are having the stroke at that moment. And when I showed you the first couple slides, we see that stroke is a common thing. 130,000 people every single year die from stroke. So it's not uncommon to be having one and thinking that, oh, my neck hurts, I need to go to the chiropractor, when really your neck hurts because you are in the middle of a stroke. Chiropractors are highly trained. We are key to look at those indicators and those signs and symptoms that help us know whether you have a spinal problem that we correct or a stroke. And if you're having a stroke, of course, we do a great job of referring you out so that you're well taken care of. There are a couple studies. One of the studies that they looked at, the National Institute of Health, they are the governing healthcare body of our government. They looked at the risk of stroke, and this quote comes from them. It's really it paints a great picture, and that is, we found no significant association between exposure to chiropractic care and the risk of VBA stroke. We conclude that neck manipulation is an unlikely cause of stroke. So that's the NIH. It's not some chiropractic organization. That's our federal government and their governing body and the best doctors determining that. This is the American Heart Association and the American Stroke Association. And they, of course, looked into this too because they have a concern about stroke and heart disease. And they found exactly the same thing, that their risk was minimal and that having your neck adjusted probably has nothing to do with you having a stroke. And their quote, the risk associated with neck manipulation and vertebral artery dissection stroke is less than 1 in 5.85 million. So remember, that's 1 in 5.85 million for having a stroke. When you look at the death rate from, we'll say, cervical spine surgery, it's 500 in a million. So multiply that times 5.85, and that's a lot of people dying from having neck surgery. So chiropractic, again, is very, very safe. This is another study, the Haldeman study, and what he found was that your risk of stroke was 1 in 8.1 million. So there's even less of a chance of you having a stroke, according to Haldeman's study. In our office, we're always trying to find the best way for us to take care of our patients. And of course, if you still have a concern about having your neck adjusted, we use techniques where you don't have that popping noise in your neck and too much twisting. It's very, very gentle. We do that old school technique where you hear the joints popping. I like to have that done. I like to do it on my patients. I find it works really quickly and it's very effective. And again, it's very safe. It's been around for eons, for 100+ years in chiropractic history. We are always going to do the technique that is going to get you better the fastest it can, but it has to be one that you like. So we always use these criteria to give you the care that you need. Chiropractic is very safe. The risk of injury is very small. We as chiropractors have the lowest malpractice premium rates in healthcare, and that's because chiropractic is safe. And that's an objective measurement right there. We should just go with that number because that's a true risk by a third party that lets us know that what we do is a very safe thing. So again, I'm Dr. Paul Koch. Thank you for tuning in. This is Uncommon Knowledge. If you have a question or concern, leave it in the comments and I'll answer those questions. If you've liked this video, please consider thumbing it up and sharing it, and we'll be happy to take care of anyone. So thank you. Have a great day.